Good afternoon. Welcome to day 227 at the St. Clair County EMA office for the daily COVID briefing. Joined here with the Chairman Mark Kern and Mila Blanford from the Health Department. Mila, you have the numbers for us today.
I do. Good afternoon. For Monday, October the 26th, we have 83 new positive tests out of a total of 872 for the day. The age range of these individuals under the age of 10 and in their 90s. 39 of these individuals were under the age of 40. The county positivity rate for today is at 9.5%, with a 7-day rolling average at 7.9%. The regional positivity rate was at 8.4% on October the 23rd. There were 0 new deaths today, so that's the best news I think that we have. Countywide, we've conducted a total of 112,000 tests, 137, consisting of 8,967 positives and 370 negatives. The total number of deaths to date is 220, and our condolences to those families. To date, the number of individuals who have completed their 10-day isolation period is 8,089. Statewide, we have tested 7,326,216 individuals. Total positive was 378,985 tests, and that's an increase of 4,729. Total deaths was 9,522, and that's an increase of 17 since yesterday. The number of COVID-related hospitalized patients in St. Clair County is at 45, with regionally we have 90. In St. Clair County, we have 3 individuals on ventilators related to COVID and 7 on a regional basis. For congregate care announcing new cases, we have Dammert with 4 new additional cases. For testing in our area, we have community-based clinics on Sunday, November the 1st at Belleville East High School in the lower parking lot. That'll be hosted by IDPH from 8 to 4. And then Wednesday, November 4th, we'll be at the Millstop Park with Southern Illinois Healthcare Foundation from 10 to 2 and then 1 to 3. In addition, we have Jackie Joyner-Kersey, who operates 7 days a week from 8 to 4. We also have Walgreens, MedExpress, CVS, and BJC, but we recommend that you go out to their website or give them a call to find out their current dates, location, and testing availability. Okay. With that, I'll hand it over to Chairman Kern for the zip code report.
Thank you, Mila. And we'll move right into the zip code report for today. These are changes in St. Clair County zip codes. They go up, they go down. Today, they all go up. 62201, we go up 3 to 286. 62203 goes up 2 to 270. 62205 goes up 2 to 240. 62206 goes up 4 to 532. 62207 goes up 2 to 273. 62208 goes up 2 to 526. 62220 goes up 7 today to 678. 62221 goes up 5 to 825. 62223 goes up 12 to 559. 62226 goes up 10 to 944. 62232 goes up 3 to 242. 62240 goes up 1 to 43. 62257 goes up 2 to 53. 62258 goes up 2 to 240. 62260 goes up 1 to 170. 62269 goes up 8 to 723. And 62289 goes up 2 to 10. If we want to look today at the daily county positivity, we had an increase of 872 tests, but we had 83 new COVID positives. That brings our daily county positivity to 9.5%, but averaged together in the 7-day rolling average, we are at 7.9%. Those numbers need to be lower. We need to be doing a better job, but we still remain below 8 here in St. Clair County with our 7-day rolling average. The regional positivity today, which is how the state looks, and we are above 8 and have been, so this is not a good number. We need to be getting it below 8 and then eventually below 6.5 if we're going to move back to the mitigation level that we all are wishing for. But our regional positivity today is 8.4%. That's derived from Bond County that comes in at 22.2%, Clinton County at 17.1%, Madison County at 8.8%, Monroe County at 8.6%, Randolph County at 10.2%, St. Clair County 6.4%, the lowest, once again, on the schedule, and Washington County at 10%. So Herb, we've got to get those numbers down in St. Clair County if we're going to drive the regional positivity down.
Well, we've been talking about that now for several weeks, and as we say, we like to keep the foot on the gas, but for some reason, the governor on the gas pedal isn't working right here, because we are going up as 8.4, and that's going in the wrong direction. And we've been telling everybody, Team St. Clair, who's been doing a tremendous job of sharing the word out there that we've been trying to give to you. If we could just get some of those naysayers to expend some of their energy on following Team St. Clair and spreading that word. 220 deaths here in St. Clair County, and one is too many. 9,522 in the state of Illinois alone. It's just terrible, and I just don't believe that there are people out there that are so insensitive to the fact to realize how serious this virus is. You can see the numbers. Our neighboring counties have got to step up to the plate. St. Clair County has been trying to do the best we can, but we've got, Bond County 22% today. And the list goes on. You've read them to them. We need testing, and people get on here and say, well, why do I need to get tested? Mila did an excellent job yesterday explaining the purpose of testing, why people need to be tested. And a lot of people last night comment, oh, I didn't realize that. So I was glad that you were able to break that down to them yesterday, and maybe we need to do that periodically, because for some reason people just don't understand that we need you to get tested. There are people out there who are asymptomatic. They're the spreaders of this. Today has been a phone call after phone call of people with concerns, businesses. Everybody is worried about the mitigations that's going to take place on Wednesday. We're still waiting for that official announcement to come. We were told the other day at the briefing that the mitigations will take place on Wednesday.
It's Tuesday at
Yes,
Wednesday morning, Tuesday night at midnight.
Right. So, businesses, as we say all along, we understand, but as I said yesterday, our businesses are doing the best they can, but then we've had people sending in information today of surrounding counties that are going to stay open. So who does that help? It doesn't help our cause. It doesn't help the region. Maybe somebody gets to put a little bit more money in their cash register, but how many people are going to be affected by overcrowding those businesses? And then guess what? Coming back to St. Clair County, coming back to Madison County.
Coming back to the hospitals.
Coming back to the hospitals. So it's really sad to think that there are people out there, and again, I've said it all along, it's a balancing act. You have to balance the fact of health over profit. And we've said this all along, if we could all just buckle down, now we got to do it for at least another 2 weeks before we even know if we're going to be able to get back down below the 6.5. It's not 8, we got to get down below 6.5.
But if the rest of the region had buckled down, we would still be open.
Yes, and that's what we got to do. We got to work together as a team. We had some questions yesterday asking about, well, have we reached out to the surrounding counties? Well, they know what we're doing. The health department is in contact with them all the time. But, there was a health department that was advocating for people to stay open in another county. That is defeating the purpose of what has to be done. To me, those are the people that says, I don't care about the virus.
The best example of why St. Clair County's numbers are still below 8 is what we are doing every day. You wash your hands, you watch your social distance, and you wear your mask, and your numbers come in. I mean, by all rights, St. Clair County, being right across the river from St. Louis with very high positivity rates in St. Louis, we are the ones that are really having to work harder just to be number one, and we are number one. The other counties could certainly be doing what we're doing, and they could lower their numbers.
Well, and we're doing it because, one, it's the right thing to do. I mean, it's our citizens that we're concerned about. We should be, the health department, their job is to make sure that the citizens in their counties are taken care of when we have a pandemic like this. St. Clair County Health Department, Eastside Health Department has been doing a tremendous job. The numbers indicate that, as the chairman said, wearing the mask, staying away from the large crowds, watching your social distancing, washing your hands frequently, evidently works because you can see the numbers. So please, I'm begging you again, and I know you get tired of hearing it, but Team St. Clair, please continue to share it to your family, your friends, your neighbors, to the naysayers out there. I don't know what it's going to take. I've said it before. If it hits your door, knocks on your door, this virus is, we're sick of it. You're sick of it. I said it the other day, but guess what? This virus is not sick of us because it's still here. And it's going to be here. We have to buckle down and we have to wait for the vaccine. Double whammy coming with the flu season. We've heard Dr. Bodeman say the other day at the press conference, he's concerned about it. One of the leading infectious doctors around was concerned when we met with him. And, as I said, you'll listen to these doctors when they tell you got high blood pressure, you got diabetes, you got a broken bone, you're sick, you go to them. They tell you to go do this, go do that. We rush right to the drugstore and get the medicine they prescribe to us. But when these doctors say wear a mask, wash your hands, and wash your social distancing, some of you look at them like they got two heads. I'm going to listen to the medical experts like we say on here every day. They are the ones that are driving this, and they're the ones that's going to help us stay afloat. So please, wear the mask, and we'll get these numbers back down. We'll be back with Daisy in a few moments to translate this into the Spanish communities, and we'll be back tomorrow with some more numbers.
Mask, gloves, soap, scrubs, TikTok, Grubhub, Twinks, Jocks, Bears, Cubs. Zoom is the new club. 6 feet, no hugs, still beat these mugs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs.
Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs.
No school, gym closed. Don't touch these clothes. Need food, this blows. Line at Trader Joe's. At home, gym, fish. Don't come close. Just wave, blow a kiss. Mask for mask, sis. Left, right, swiping on Tinder. What was life like? I can't remember. Needing my haircut, somebody shave her. Where is all of the toilet paper?
Gloves, soap, scrubs. Mask, gloves, soap, scrubs.
Okay, dolls, y'all know what time it is. Come on, stay inside and lock the door. Stay inside and